A closed, simple fracture is a break in the bone where it does not tear the skin. An open fracture is a fracture where the bone breaks and the sharper end of the bone does protrude through the skin. A comminuted fracture is where the bone breaks into fragments, which is most common in older people. An oblique fracture is where the fracture breaks at an angle other than a right angle. As you can see in the picture, it's more slanted downward. It could either be slanted upwards or downwards, but when it's straight across, that'll be right angle, which an oblique fracture is not. Spiral fracture break occurs due to excessive twisting forces. So if you were skiing and you got your ski caught and it either twisted inwards or outwards, that could cause a spiral fracture, which is most common in athletes. A green stick fracture is a bone break that doesn't break completely through. It's common in children. A transverse fracture is where the bone is broken at a right angle to the long axis of the bone, which in this case would be the exact opposite of an oblique fracture.
So we'll splint the arm first. First we have to check the pulse and blood flow. Okay, and then we check for sensory. Can you feel this? Mm-hmm. Can you move your fingers? Okay. And then after we have to put the splint in. And wrap in gauze.
Took him out, bled him out, messed with his finger.
And we'll check the blood flow and pulse again. And we'll check the sensory. Can you feel this? Yes. Can you move your fingers? Mm-hmm. And that's the first splint. Next we'll be doing a sling. You want to put the arm in gently and make sure the elbow's at the very back. When you put it in, you want to make sure the arm is at a 90-degree angle. Once it's there, you wrap gauze around the area. And that's the splint. Next we'll be doing the leg splint. So first we need to check the pulse and the blood flow, and then the sensory. Can you feel this?
Yeah.
Can you move your foot?
No.
Then we're going to lift the leg up and put the splint under gently.
As you can see, the splint is not necessarily the size she needs. We did not have access to one of her size, so we had to make do with what we had. But in cases where you do have what you need, you will use one that is more sufficient to the patient's leg size.
Then we're going to check the blood flow again and see if she can feel it. Can you feel it? Can you move your foot? And those are all the splits.
Hey, I'll do something because that's it. You gotta.